No. We're good to go, Megan.
Welcome everyone to today's Link Senior webinar. We'll get started shortly. Good afternoon and welcome to today's Link Senior webinar. Today we will be providing one free NAB, NCAP, and NCCDP CEU credit. In order to be eligible for the CEU credit, you need to remain on this webinar for the full hour. The Zoom meeting room will track how long you remain in the room and will send that as a digital report to me. We are not able to provide CEUs to those who join only by phone. You must be logged into the Zoom room. At the end of today's webinar, I will provide the required post-webinar CEU survey evaluation link in the webinar room chat box. And I will also send it by email this afternoon. Please be sure to check your email spam folder. If you don't receive the link this afternoon, please do email me right away so that I can send it to you directly. I'll place my email in the chat box right now. You need to fill out the CEU survey no later than midnight this Thursday, August 27th to be eligible for the CEU credit. And if you're not looking for CEUs today, we still want your feedback. So please go ahead and fill out the short survey as well. CEU certificates will be issued by email on Friday, August 28th this week. Again, please check your spam folder. You will also receive a PDF of today's slide deck presentation and a recording of today's webinar by email this afternoon. We will be live streaming this event in our Activity Strong Facebook group, but for CEU credit, you must be logged into the Zoom room today. And now I'll hand it over to Charles D. Vilmorin, CEO and co-founder of Link Senior.
Thank you so much, Megan. Good afternoon, good morning, everyone. Welcome to our August 25th Activity Strong webinar with the title of Using Positive Psychological Approaches in Resident Engagement During a Pandemic. I'm very, very excited to have Dr. Taylor, Jen Taylor of University of Wisconsin at La Crosse be our presenter today. And as a quick note, as some of you might have been on our webinars before, we do have the two tools from Zoom, the chat and the questions and answers. So feel free to use the chat as much as you want, but just as a note, we will only monitor the questions and answers given the sheer volume of participants today. So as Megan said, my name is Charles de Vilmorin, and I'm the CEO and co-founder of Link Senior, and it's a pleasure to have you today. What I'm going to do is just give you a quick introduction to these webinars and essentially start off by saying that we started at Link Senior our educational opportunities back in almost 2 years, actually more than 2.5 years ago. And the main intention is we believe that the more educated activities and life enrichment and rec therapists and wellness coordinators are, the better the experience for residents in senior living and long-term care. So we've been providing these webinars free of charge, and we've been also providing CEUs to help you, everyone on the line, find out about the best type of education, the best practices, so that you are equipped to deliver the best experience to the older adults you serve. As you can see from this slide, we've been very fortunate to attract fantastic speakers, including today, that are really leaders when you think about the whole resident engagement field. With that, and as I always do, I also want to extend an invitation to anyone on the line. If you believe that there is a speaker or topic that we haven't addressed yet or that we should reconsider, as you know, a lot of our speakers come from ideas and referrals from people like you, so feel free to send us a note. Now, I just want to give you a little heads up and background on who Link Senior is. So Link Senior is this company that I founded. We are based in Washington, D.C., and we serve today, we touch more than 41,000 lives in 43 states in Canada, and we serve resident engagement professionals across the spectrum from independent living to assisted living to memory care and nursing homes. Our work has actually been published in the sense that we had a reviewed in a peer-reviewed publication back in September, where for a whole year in 3 communities, we were able to analyze the impact of our work. And as you can see, these outcomes were pretty meaningful. And if we're considering the COVID-19 pandemic, anything related to increase in social engagement is a huge topic these days. So again, very proud of this work, and again, really showing how resident engagement can be measured. I'd love to share with you also a little bit about what Link Senior does besides resident engagement. We firmly believe that all people are cool, and started this initiative about, I think, 3 years ago. And we are also the people behind the Activity Strong initiative launched in March in response to COVID, and as a way to acknowledge, educate, and empower activity and life enrichment staff. And I'd love you to stick around for the whole presentation because we have a few really exciting announcements that we'll share at the end. But with that, I'd love to introduce you to Dr. Taylor, who is the assistant professor at the University of Wisconsin-La Crosse. And she is also a motivational scientist. And Dr. Taylor is actually in the business of motion promotion, which I think is fantastically relevant these days, considering COVID-19, what we're all going through in our communities, and how we consider improving the experience of our residents. So with that, I'd love to share just a couple of thoughts before we hear her deliver her presentation. And these are just quick thoughts about where we stand, right? I think the first thought, which is something that I do on almost all of our webinars and every single time I interact with one of you, is that I want to pause and thank you for the essential work that you do, right? I know that a lot of you come to all of our webinars, so you've probably heard me say that on and on and on, which probably now is almost close to 10 or 12 times. But the work that you do is essential to the well-being of the older adults you serve, the residents. The work that you do is essential to the point where you are the ones helping these residents be who they must be and bringing purpose to their lives. So as much as we still debate how essential your work is, let me tell you that your work, beyond being essential, is actually the key to helping these residents be who they must be every single day. And I think that you're also the key to helping our industry stay, quote unquote, human, right, which is really important. And I think that also, as much as we're going through understanding what are the struggles and finding out how we go beyond fighting, but try to understand how we live with COVID-19 and what it's going to do to us, I want to share something fantastically positive and full of optimism, which is a stat that we've been collecting. And just the mere fact that 91% of us, of you, believe that resident engagement will come out of this being COVID-19, stronger, right? So I think that it's really important that to understand that we're going through very, very challenging times. I speak to staff. I mean, honestly, some of you have been going through hell and back, sometimes several times a month, a week, or a day. And I think that what you do every single day is the work of heroes. But I think that beyond that, if you were to look on the middle or long term, we will all get out of this much stronger, right? So there is hope, and we're all working towards that together. So with that, I wanted to use that, statistic to also remind us of our work, which is to help these residents live with purpose, and share with you how excited I am to have Dr. Taylor take on this presentation and help us understand how positive psychological approaches can be incorporated in our daily work when we think about serving our residents. So with that, thanks everyone for joining. Thank you, Jen, for leading in this presentation. I'm very excited for it, and take it on.
All right. Well, thank you so much, Charles, for the introduction, and thank you for having me out today. I want to kind of start just a little bit about my background so you guys can kind of see where I position myself just a little bit. Charles says I'm a motivational scientist. Yes, but, and there's a big button there because I worked in the field for 15 years before going back to doc school at the age of 37, which is not a typical age for going back to doc school. But I was really curious about positive psychology, to be honest with you. And I worked with older adults. I've worked in geriatric psych. I worked in long-term care in the Midwest, covering over 5 states. I was working in community parks and rec and directing a senior center there. And it just really kept turning in me this idea of positive psychology. And I'll be really honest, I'm kind of a born optimist. That's kind of who I am. I'm a positive person. My husband is not. And so I think that it really helped me to see, as our spouses sometimes and our partners sometimes balance us out, he really challenged me to be like, can you teach someone who's not a born optimist? I get that, Jen, that you're kind of raw all the time. That's just who you are. But he's not. So that's what really kind of stood out to me. And then I was working in long-term care and offering support at the corporate level, so lots of trainings. And I kept going to facility after facility, and I was seeing these great things, and they're saying these activities are working, but we don't know why, and we don't know why this is going on in this group, and this isn't going on in the same group. We're doing the same activity. And that's when I really started to be challenged of, can we teach this to facilitators? And I guess in one word, yes. That's my answer, is yes, we can absolutely teach this. These are skills that can be taught. Now, some of you, I would even say probably a large majority of you are already born optimists. How many born optimists do we have out there in the chat? Do we have a lot of born optimists? Woohoo, hands up, born optimist. You kind of have to be with activities a lot of the times. Yes, okay, Nancy Richards, all right. So, but our residents aren't always there. And so can we use these approaches? So my goal for today is not to teach you everything about positive psychology. I don't know everything about positive psychology. I love Julia Childs, one of my favorite chefs. She says, the more you love about something, the less you'll know, because there's just so much more that you can learn. So my goal really today is to really increase your curiosity about positive psychology. And not only about that, but how can you then apply it to your residents and in your programs on a daily basis. So I don't care what activity you're doing, it's not about the activity. These can be incorporated into everything. So with that, we'll kind of get started and rolling, and I'm happy to answer questions. We're gonna have questions at the end, and then to follow up by email. I love to have a good email chat if anyone is interested. So my information will be there at the end. So fun to see all the states too. Whew, I'm loving it. Pennsylvania, everyone's here. New Jersey, Florida, all right. I guess we can all be together online, right? Okay, next. Okay, so of course, because this is a CEU, reputable presentation, we like to have our objectives. So I wanna make sure that you guys get from me what we came here to talk about. We're gonna be able to verbalize the 3 cornerstones of positive psychology. And those are really positive emotion, positive individual traits, and positive institutions. So you're already checking things off the list. And then we're gonna delve deeper into those. But those are really the 3 cornerstones that we're gonna be talking about today. Next is we're gonna verbalize at least 1 philosophy. I'm gonna talk about 2, but I really want you to just bring 1 away. So for example, the best friends approach and how you can use this philosophy in your practice. So I don't know if you guys are using best friends. It'd be kind of interesting if anyone wants to kind of say that in the chat if they're using the best friends approach in their facilities or at that organizational level. If you don't know what the best friends approach is, we're going to chat about it today for a minute as well, so you can kind of see it. If not, you can always Google it too, but to get more information. So action item number 3, we're going to get an action item. So I'm one of those people that if I don't have something written on a Post-it note, it's probably not going to happen. So if you do have Post-it notes, if you're at your desk, grab one so that you're ready for the action items. But I want one thing that you can actually do and leave with. I'm not a theoretical motivational scientist. I am a motion promotion, and that's motion in the sense of older adults, but motion in the sense of us as staff. So I want to actually, let's get things moving. So you're going to have that as well. So next. So just some terms to use. Now we have a lot to cover today, so I'm going to probably go through the slides rather quickly. I'm happy to provide these for people. I saw that as a question. I'm happy to provide a PDF of the slides if you're interested in sharing this with your staff. I know sometimes we can't, Post-its are my best friend too. There we go. We can't always have all the staff members there because they're out serving residents, so I'm happy to do that as well. So just some terms to know: the tenets, positive emotions or practices, interactions with others and institutions and society. So that's the word tenets. Care theories, we're going to be looking at person-centered care, strength-based care, relationship-focused care. These are all ones that all surround that care theory approach that we're going to be talking about. Also in techniques, appreciative inquiry, and then compassionate communication. So we're going to touch on some of these and how they actually incorporate into that best friends method, and then move from there. So with that, our dementia care approaches that we're going to cover today, the best friends approach to Alzheimer's care, and then also Teepa Snow's a positive approach to care. So specifically, we're going to, I know, love Teepa Snow. We're going to go ahead and we're going to be looking at the GEMS approach to that. So if you haven't seen her GEMS, it's actually a pretty neat thing, and we've done a lot of stuff as an activity director. I've done a lot of stuff with the GEMS because it's a really nice way to kind of also show staff where we're at, meeting people where they are on their journey. Okay, next. So what and why is positive psychology? So I think we really hear about positive psychology a lot more than we did. This is going to actually, Charles, there's a couple of animations that are going to come up. You can just put the whole slide up. That's totally fine. Yep, let's just do it that way. So with the what and the why of the positive psychology, I really start with why. Like, why am I even going to learn about this? Why would you even do it? And then why does positive psychology work? So really, in a nutshell, positive psychology, over the years, science has really looked at what makes people ill. So with mental health, having worked in mental health, we diagnose, we don't talk as much about strengths, we talk about what makes people ill, whether that's socioeconomic status, number of issues or challenges, but really positive psychology started looking at what makes people well. And you might see, wow, that doesn't seem like earth-shattering, but it really was. It completely changed the way that psychology was viewed. And then what is positive psychology? So positive psychology is really the study or the condition of the process that contribute to the flourishing or optimum functioning of people, groups, institutions. So that's really what positive psychology is science all of a sudden, the science of psychology all of a sudden said, hey, let's focus on why is this person doing so well, especially in aging and in dementia care, specifically for our needs. Why are some people doing so well and some people aren't? Let's look at the people that are doing well. And what they saw time and time again was this positive psychology approach. So does anyone know he's called the godfather of positive psychology? He's written a myriad of books. Two of my favorite ones are Flourish. And then if you're not a born optimist, I would highly recommend, it's called Learned Optimism. And he does some great work out of Penn State. But his name is, drumroll, Martin Seligman. So Martin Seligman, if you just know one name for positive psychology, you want to know Martin Seligman. So he has really established this entire field, still alive today, still doing webinars and classes. So if you're interested, it kind of going to that next level. They have all kinds of certificates and tons of free resources on their site. So, you know, check it out for the Penn State Authentic Happiness. There's great quizzes on there that have all been tested at that scientific level. All right, next slide. Okay, go ahead and just put them up all up there. Okay, so this next one, I just want to talk a little bit about how you can actually change your brain in 60 seconds. You know, we're always kind of running around. This first one, and I want you guys, if you can, because I'm into motion promotion, so I want you guys to go ahead and yawn and stretch. So really take it up over your head, yawn. Ooh. Don't touch your face, right? Yawn. Now you need to do this multiple times, about 10 times. So yawn again. I wish I could see everyone. It'd be kind of fun to watch, you know, 600 or 700 people yawn at the same time. So really, if you do this, now of course you're distracted and doing a lot of other things right now, but if you take 60 seconds and actually yawn 10 times and stretch, it triggers different parts of your brain. And so it changes what is going on inside your brain. And this can work with residents as well. Now, if you want to see a great YouTube, if you look up Mark Waldman, and again, I'm going to post these PDF of these slides so you can check it out. But he has a bunch of different exercises on there. So when you're yawning and stretching, thinking about your innermost value, you can kind of, if you're not one that has tried any meditation, this is kind of a great way to start, where you're just thinking about one word, thinking about the value that comes to mind, repeat the word to yourself, whatever you need to do. Now, hopefully you won't yawn too much during the presentation, so we'll get that out of the way at first, but definitely try the yawning and stretching. And I encourage you too to do this before a staff meeting, okay? We are doing staff meetings very differently, right? A lot of them, maybe they might be virtual. For those of us that are still working in facilities, you're still face-to-face, but having some different things happen and just doing this yawning and stretching is great. This other one, run in place. Now, my son, I have two boys, a 1-year-old and a 7-year-old, and he likes to laugh because he says, I don't ever run. It's really more of a fast walk, but that's okay. That's okay. He loves me anyway. He tells me that. But running in place for 15 seconds actually can change your brain as well. And this is not just, you know, Jen Taylor saying, hey, try this out. This is scientifically proven that these are areas, and these are things in the positive psychology world where you're going to be starting to, you know, start to activate where those positive emotions are felt. And that's in the amygdala of the brain, okay? This last one is savoring. So we might have tried a savoring group, maybe not. But really being able to focus on one thing at a time. I love bringing in a flower or something like that. Now, even, you know, I tried to be fancy with my background today, but even choosing things like this, putting up pictures of positive things where the flowers are. These aren't real, guys. These aren't real. I'm in a, you know, a little dumpy office just like y'all, okay? I've been in the copy room. They didn't even change the sign on the door for 3 years, okay? So, but surrounding yourself with beauty when you can, even if it's a picture or picking a flower on the way into your office and putting that in your office, that changes our brain because it can bring up some really great emotion. It can bring up that savoring. It goes back into the meaning making and, oh, wow, where did I smell this scent? When I smell lilacs, I think of my grandmother every single time. And so if you're able to connect that with your residents and your residents see that, then that's a great way that you can do. So those are just 60 seconds to change your brain. Try them before a staff meeting or in the middle of a staff meeting if you want to. All right, next slide. Okay, so I want to point out real quick before we go any further that there's a difference between positive psychology and positive thinking. Now, I am not trying today to tell you to put on rose-colored glasses and, you know, make lemonade out of lemons, okay? Sometimes and some days you gotta embrace the suck. Like, this sucks. Like, this is not what I wanna be doing right now. I don't wanna be wearing a mask when I'm trying to talk to people. I wanna be hugging my residents. I wanna be doing all these things that we know are so important in social connection, but right now we can't, and it sucks. So I just want to challenge you guys that this is not put on your rose-colored glasses and pull up your bootstraps. These are what can I do to really make the most out of every day. And I firmly believe that positive psychology has the ability to have us change our brains and to have us change the way we're looking at resident engagement. So when you see positive psychology out there, this is evidence-based, it's psychology, it's neuro, you're resetting different parts of your brain, it's comprehensive, they use it for treatment and depression, anti-stress, social success, positive thinking, all that motherly advice, great, you know, I love my mom, all of them, but at the same time, you know, it's not that, it's not this casual thing. These really are scientific techniques that are proven to change people's lives. So, you know, happy thoughts are great. Positive emotion and triggering those are much, much better. Single focus, no matter what, we don't want to deny what's going on, right? Like this, you guys are doing very hard things. I've been in that activity director chair when you have so many treatment plans to do and you got 3 groups going on. And so it's just, there's so much in the world right now. So I don't want to think that we're just think happy thoughts and you'll be fine. Positive thinking is also not a treatment for depression. And honestly, it's ineffective because if you can't maintain that positive thinking, there's really nowhere to go from there. So positive psychology, it really is about techniques and science. Okay, next slide. So when we talked about in our objectives, the focus of positive psychology is on encouraging positive and effective behaviors. Okay, so we are looking at behavior and specifically human behavior. So there's really 3 cornerstones that we talked about: positive emotions, positive individual traits, and positive institutions. So all of a theme of positivity, right? But how do we do this? What does this look like? So we're going to delve a little bit deeper. So positive emotions tend to be those that elicit some immediate sense of joy, which is very connected to the present. Okay, so those are the positive emotion, that joy, that happiness when you feel good. Positive individual traits, those are which we can learn about and adapt to enable us to live better lives. So we all have specific positive individual traits. I'm going to show you a great quiz if you want to do it with your staff. I did this with a lot of my staff. So you can see where people's strengths are and then really build on those. We actually make little posters and post them on our wall. We did it with our residents. It was a great way to kind of show people what are our strengths. And then positive institutions, those are those which surround us and help us to lead our lives in a better way. So those are the 3 different cornerstones of positive psychology. Oh, next slide, sorry. So the good life. So this is the first one, positive emotion. This is really where people look at happiness, joy, feelings that you get when good things are happening to you, or even life experiences that are pleasurable. So, and if we can get these experiences, you can actually increase your happiness levels. So just by increasing these levels of positive emotion and pleasurable experiences. Now you're like, hey, don't know if you heard, Jen, but a pandemic's going on. Yes, I have heard, but the problem is that we still have to live our lives, and we are responsible for a lot of residents' lives as well. And so if we can bring about more pleasurable experiences, then we can actually increase their happiness even when in the midst of a pandemic. Next slide. Okay, how many people have taken the character strengths quiz? Has anyone done this at all? You identify strengths, virtues, and developing them. Yes, it's very good, very good. If you haven't, it's completely free. This is another one that's not just a feel-good quiz. This is all the science is behind it. They're reliable, valid. They've done it, I forget how many, they're like up to, I think, oh gosh, I want to say 18 million or something like that. Huge numbers of people. And this is really one that I love because it's free and it takes about 30 minutes to do, but you can really turn it into a great staff building exercise. And then you can, everyone kind of talks about, well, my strength's this and my strength's that, but it's also great when you're when you recognize people's strengths, because then you can actually say, hey, you know, you really have this appreciation of beauty and excellence. Do you want to maybe take the lead on this project or that project? So when we know our strengths, we can play to them. So within that study and a lot of the research too, and not to get too bogged down, but if you use your strengths every day, so it's like, well, that's great, I know what they are. But if you use your strengths every day, you're 3 times more likely to report having an excellent quality of life. Not bad, just by using your strengths. So if I use any of these strengths that I have, perseverance, you know, I get to use that one quite a bit. I live on a 14-acre apple orchard, and farming is hard. I'll just be honest on that one. So when I get to use that strength though, I'm 3 times more likely to report having an excellent quality of life. And I'm 6 times guys, more likely to be engaged in my life, right? So we talk about this lack of engagement, lack of connection right now. Well, if I'm using my strengths every day, I've got this bigger chance to have a higher quality of life, and I'm more likely to be engaged in my life. So it's really kind of a cool thing to know about. So take the quiz if you haven't. It's over on the VIA. I put the website on there, but if you Google it, it's like the top marker, and then character strengths, okay? Oh, I can state the stats, yep. 3 times more likely to having an excellent quality of life, 6 times more likely to be engaged in your life. Okay, so, all right, I don't know, sounds good to me. I don't know, I'm willing to try it. Here's the thing too, if you try it, what's the worst that can happen? Even if you're 5% happier, that's better than where you were. So just saying, not a lot of bad on that. Okay. Oh, it works, trust me. Lisa, I'll trust you on that, Lisa Robinson. All right, let's go on to the next slide. So positive institutions. So this is where we really kind of have a big effect on our staff and our residents. So positive institutions are those which surround us and help us to lead our lives in a better way. So when we understand positive institutions, we understand how much we can affect people. So understanding them, we get the meaning and the purpose, the strengths that foster better communities, responsibility, civility, engaged residents, right? Like that's all we hear about right now is how do we connect residents and still engage? Well, when we understand that even the small things that we might consider small really make a big difference. And for those of us that are, even living in our family homes right now, even sitting and having a cup of tea, I started doing that and taking 10 minutes, which I could not believe. I'm working from home right now. And even taking 10 minutes where I just sit and be still has been amazing. It's totally changed my summer. So as you can tell, I'm kind of a little bit high strung, but you kind of gotta be, you live on a farm, you teach, you do all these things just like you guys have a lot of things going on. All right, so let's go ahead and go to the next slide so we can kind of see a little bit of our positive institutions. I've highlighted in red the one that we're talking about today. So these are all positive institutions though. So it's kind of an odd word. I don't know why they chose that word for that, but I guess, really what we're talking about are everything that surrounds you. So it could be your partner, your family, your friends, your education, your work, right? That's what we're focused on today. Your community and your society. These are all positive institutions. So if you can bring about more positive institutions into your life, you can actually also increase that happiness level, which, human happiness is pretty elusive. So anything I can do to, get it to the next level. All right, let's go on to the next slide. So I do want to show you guys this model. So I call myself a pracademic because I was a practitioner first and now I'm in academia, woo! But I'm a practitioner at heart, I'll be really honest. And so I want to know how I can apply these principles every day. Like I go to work, I want to try something. I want to do something that's going to change lives because that's why I'm there. If not, I'll go do something else that, frankly, you're probably going to get paid more and work a lot less. I'm just saying. But we do what we do because we love it and because we make a difference in people's lives. So this is called the PERMA model. This is Martin Seligman. So again, the godfather of positive psychology. And he has shown us, this is in his book, Flourish. If you haven't read that book, Flourish, I highly recommend it. But he has these 5 areas that really affect people's well-being. So if you want to flourish in your life, and if we want to help residents flourish in their lives, these are really the 5 areas that we need to be aware of. So we have positive emotions, relationships, accomplishment, engagement, and meaning. Now, I'm not going to go into all of these different areas, but I want to leave this slide up here just for a minute so that you can understand that there's a lot more out there. If you just look up the PERMA model, there's some great YouTube videos on it. If you're new to it, again, that Flourish book by Seligman's great. It's an actual, you know, easy read, and it has a lot of the happiness and flourishing research behind it. So if you're interested in that. But if we can look at these things, all of these things really can be completely addressed in resident engagement. So if you're looking for where am I going to base my program around, and what model or theory, a lot of people want to say, you know, what is the evidence-based theory behind your program or the model behind your program? Hands down, this would be my most favorite way or model for service delivery. Because you can absolutely base your groups, each one of your groups, on one of these 5 areas, and knowing that you're creating well-being for your residents because it's been scientifically proven. So looking at that, I think you guys can all see the positive emotion when we are encouraging our residents to have these happy emotions. When these relationships, you see the social connection, accomplishment, you know, whether it's an art project, or a great poem that someone wrote and got to perform. Engagement, it's what we do every day. And meaning, we are making meaning within this, but then I also bring back onto their meanings that they've had in their growing up life. I call it the growing up life. So I just want to challenge you to dig a little bit deeper and check out the PERMA model on that. All right, next slide. Okay, 2, I love to read, so it's kind of my thing, and I read books. I can't do it on the tablet, still can't do it. I like paper. So this is another book. It's Positive Psychology Approaches to Dementia. This is hands down the best book out there that I've found and read that really talks you through how it relates specifically to people with dementia. And so I really want to challenge you too, if you have a staff library or anything like that, this is a great one to kind of start out with. I've used it in the sense of I've used a chapter, and then I just would photocopy the chapter and have all the staff read it. And then we kind of talk about it at our next staff meeting or in service. But it really does provide in straight talk what it means to have positive psychology approaches to dementia and in that population. So, and a lot of it can be transferred over to your assisted living populations. It doesn't have to be just for memory care because it really teaches the cornerstones of the positive psychology. All right, next slide. Hopefully I haven't built your Amazon book list too long. It's almost Christmas, right? All right, that's what I do. I just put them on my Christmas wish list. I know, I'm turning 41 on Saturday and I still have a Christmas list. So that kind of tells you what kind of a gal I am. So here we go. Now it's like, okay, Jen, I've bought this positive psychology stuff. I can accept it. Yeah, tell me, let's see. But how does it look? How does it look when we're planning a group? Oh, it's like, ooh, the cornerstones, the tenets. Yeah, really good. I love the PERMA model. But what does it look like when you're like, yeah, I've got 4 groups today. How can I make this work and incorporate it? And don't be afraid to try things. I think that's the pandemic. The positive of the pandemic is that people expect a lot of failure. So it's okay to fail. It's like almost a badge of courage. You tried something new and you're going to try things and they're going to absolutely fail. And you're going to, for every 9, you're going to have 1 that's just going to the moon. And all of a sudden you're getting asked to talk at this or that, or, you know, go on Good Morning America, who knows? But in the end, it's going to be those people, the innovation that started out. So it is a badge of courage. Failure is a badge of courage. And if you're not failing, you're probably not stretching hard enough. So I just want to tell you on that. So let's flip to the next slide and get some ideas for people. So I kind of broke these into different areas. This first area is gratitude activities. And so that first picture there is a paper bag journal. If you guys haven't done paper bag journals, but they're a great way, very inexpensive. You can get a lot of paper bags. And so you actually tuck different things in the journal. Great one to do if you're still social distancing to the point that you're having people in their rooms. You can pass out the supplies before, pass out magazine or whatever before, scrapbook paper, and then it doesn't take a lot of supplies. And then two, what you could do, I was trying to think, well, how do we then show it? So then if people are maybe out right outside their door, they can show their journals. If you're using a lot of virtual stuff, they could do a little, you know, vlog about their journals, but these are gratitude journals, they're paper bag journals. Also, just even writing on your own sketch pad in the middle where you kind of write your notes. Ooh, I got to bring, you know, I got to bring cards, a deck of cards to room 201B. Don't forget. I started saying what I'm grateful for. And so just to remind me that I can be grateful for things, even in the midst of trying to figure out how I'm going to teach online. I hate technology. I'll let you know that. Well, I don't hate it. We just don't get along. But so I still have a paper calendar. I love it. And so I want to know what you're, you know, think about what you're grateful for. What was something good that happened to you today? And there's actually a science to that of counting your blessings. So if you even write down, speak verbally, if you tell someone else, there's all different levels as far as that. So the gratitude jar, that's also a great one for staff too. So before I had this just in the activity room, but then I started putting it in our staff rooms because I got into some toxic teams, had to clear house a little bit. And so I started having them acknowledge what was their joy wall. We had a joy wall, we put Post-it notes up on it, and what was the best thing that happened to them during that week or that day. All kinds of art, gratitude trees, anything that we can kind of express appreciation for. So, and you don't have to have anything back from that, right? Also, if you haven't seen the Kindness Rock Project, there's some great YouTube videos on that. I was down in Kentucky and they started the Kindness Rock Project right there in their facility. So check out the Kindness Rock Project. They had rocks hidden all over the facility with just positive quotes or positive words, and the residents would find them and see them, and then they'd hide them somewhere else so that it was kind of this thing. We also did a positive psychology Easter egg hunt at a conference I was at. Again, just writing positive quotes. We put them in a little plastic Easter egg and spread them around the conference center and just had people open them up and post them to Facebook or whatever you do. So I know you guys, I'm sure, have some amazing ideas. Share your ideas. That's always, I'm so glad, Charles, you got a Facebook page. You guys have such a great platform for sharing all the wonderful things you do. I think in the news, we hear so much about the horrible things that are happening in these, in the long-term care facilities, but I also know that there's joy, there's innovation, there's amazing things that are happening, and we don't get to hear about that as much, but hopefully, you know, you guys jump on the Facebook and enjoy the great things that are happening on there. So that's gratitude activities. So we're gonna move on to savoring. Oh, forgiveness, I'm sorry, forgiveness first. So forgiveness, so this is always, these are groups that, the forgiveness groups, I really like co-leading with social workers, or if you have a minister or nursing, these are great ones to do, especially now where you can actually do quite a bit of work on forgiveness with older adults. But if you're not comfortable with it, totally fine, just pair up with someone. And if you ask a social worker or a nurse, hey, do you want to pair up on this group with me, and I have this idea. We use a lot of writing for this. If you talk about bibliotherapy, if you've heard of Brene Brown, she has some great worksheets. Just look up on her website. She has I mean, she's all over the place, but she has great worksheets that I've used and adapted for long-term care. There's forgiveness games. These two, I don't want you to think that the whole group has to be about forgiveness, or the whole group has to be about gratitude. These are things that you can do at the very beginning of any group, okay? So I work with a program called Bingo Size. It's a fall prevention program and health education program, but we really started, guess how we start the group? With a joke. Like we're telling jokes in, you know, in that exercise class. So just know that this doesn't have to be the whole group. It can just be one piece of it, or it can be the whole group. It's kind of up to you. All right, next slide. Okay, so savoring. I think for me, I will let you know that I am a pretty fast-paced person. If you can't tell, I talk really fast. Savoring is the hardest thing for me to do. And so I use this scone method all the time, especially with my children who have slowed me down, believe it or not, more than anything, because I don't want to miss out. You know, what is it with parenting? The days are long, but the years are short. I think that was the best quote I ever heard about parenting. So, you know, I use this scone method. It spells out scone. One, scones are probably just about my favorite food. I love scones. Anyone that knows me, a scone and a chai is like my heaven. And so I use this scone method. The scone method, there's a lot more to it, but I just want to kind of, again, go ahead and just engage your curiosity so that you can go and Google a bunch of stuff, okay? So slow down, consider the context, open your senses, notice your thoughts, and enjoy the moment. So I want to tell one little story right here. My 7-year-old, he was 5 at the time. I was so excited. I love fall and love watching the trees change and everything. And I said, oh, his name's Reagan. I said, oh, Reagan, the trees are going to change so soon. It's going to be so beautiful. I just can't wait. And all the fall stuff that's going to be happening, I just can't wait. And he just looks at me and he says, Mom, it's beautiful right now. And I just thought, you're right. Like, I don't want to just be thinking about the future. It's beautiful right now. And so really have yourself a scone if you need to, but really sit down and try this method and with people. You know, you don't need to be the one talking all the time, right? Why am I talking? I think that's another one. Why am I talking? That's another great acronym and things like that. So lots of different techniques you can use, but check out that scone method. It's all over the internet, so you'll be fine on that one. All right, let's go on to our courage activities. All right, so courage activities. I did this, this is not mine, but we did make a wall of courage. And so we had all these different resident stories. It was when they were doing a lot of those living histories were getting really popular with residents, probably about, well, I guess probably 6 or 7 years ago now. But I wanted to highlight them in one of our actual facilities. And so we did this wall of courage, and anyone that had done something that they felt like was a big thing and they did it anyway, whether it was move to another state or, oh gosh, we had so many different things. Oh, one lady, she did a beauty contest. She always wanted to be a beauty queen. And so she became, you know, one of the senior beauty queen contests, and she won. So these are really quick and easy things that you can do. Again, this doesn't have to be the whole group. You can say, you can just put up, say courage is, and then just have people write Post-it notes and post them up on the wall. I do encourage you, if you're using Post-it notes, use the super sticky ones so that they stay up there and not are constantly falling down. But you can do these walls of, you know, walls of courage, courage stories. We did all these storytelling and short stories. So it's a great way to do it. So those are engaging through courage. All right, next slide.
I did just a quick time check. We have about 4 or 5 minutes left. Yeah.
Yep, we're good.
Cool.
Yep. Okay, so I'm going to go through. I just want to highlight you guys. Humor is another one that you guys can look. A lot of you guys are probably doing this now. If you haven't seen laughter yoga, it's a pretty quick certification, so check it out. And it's great just to say laughter yoga. I mean, come on, who's not interested? All right, next slide. Okay, so this last slide, and this is wrapping up in the group section. I just want to remind you that creativity is not just about art or music or writing. Creativity is really growing and learning and making something original. Albert Einstein encouraged creativity is intelligence having fun, right? So don't feel like I'm not an artist. An artist is anyone who creates. If you create something, you are an artist. So it's not just about that, okay? So think about that when you are trying something new. And again, if you're scared to try one of these things, guess what? You got another group in, you know, an hour. So just do it different again the next time. All right, next slide. Okay, so now I'm moving into the best friends approach and the Teepa snow. So we're going to be looking at a little bit of how this is different. Now this could be a whole webinar in itself. So I really just want to spark your curiosity. If anyone is using the best friends method, that is wonderful. I would really encourage you to connect and talk about how the culture is really different, because we're not just talking about in the activity department. Now, I have seen the best friends approach used starting in the activity department where they've become the trainers, and then it kind of spread throughout the facility and really changed the culture. But I just want you to be real clear that deficit-based thinking, that's kind of the common approach in older adult care. We are looking at the asset-based thinking, which is the positive approach. Next slide. So if you haven't heard of this, this is something that you'll want to Google and look up afterwards. This is the best friends approach. It's really about relationships, acknowledging that a person with dementia or with Alzheimer's disease, other dementias, they really need a best friend. They need someone that knows their story. So this is kind of an approach to care that's being taken up, and it's a whole training program. There are certifications. It's really not that bad money-wise if you can get, because it's not just an activity training. So you want to look at with your executive director on this training. Okay, and then the next one, Teepa Snow, one more slide. That's just, I actually left this in here because I'm going to give you guys the PDF so you can kind of have a little bit of information about it. All right. So with Teepa Snow, the positive approach, if you haven't seen the gems, this really aligns up with the Allen Cognitive Disability Scale. So a lot of you might use the Allen Cognitive Disability Scale. She has the 6 levels. She really talks about gems and kind of what are the positive things that are going on, not just what they've lost, but what is still there and what is still intact and what can we build upon and what are their strengths. So I put the gems on there to remind you to look at the gems. And she has the 6 different levels, just like the Allen Cognitive Disability Scale, and that's from occupational therapy. So try it out. I want to leave you with just a couple of things. So next slide. If you haven't seen this picture of an older woman or a younger woman, which do you guys see? Old woman or younger woman? You got to think about that. With the pandemic, I think it's really easy to go one direction. And when you have one person that's going to this negative route, don't go there, okay? Stay towards this other way. You have to be able to stay focused on what are the positive psychology approaches to this. What are the things that work? What are the things that other people are trying? But this, we can be looking at the same picture. This can be, you know, the picture of the pandemic. We can be looking at the same pandemic and see very different things. And it's going to be your choice. Do you want to see it and go this kind of woo down way? Or do we want to say, whoa, these people are doing these amazing things? So really try it, try something new. And that's what I'm going to leave you with on this last slide. I want you to think about, if you can go to the next slide, last one. Yep, I know this picture is, it's been around for a while. I want you to think about one thing that you want to try from today's webinar, how you can implement during the pandemic. Don't wait until times are better, guys. This is going to be around. We got to live, you know. Write down your idea because we know that that makes it better. Write a cloud around it so you remember, oh, it's a webinar idea. Write it on a Post-it note and then tell one other person, because if you tell one other person and have an accountability buddy, you're like, I forget 1,000 billion times more likely to actually do it. So with that, I want to thank you for having me today. I could talk about this obviously all day, and I just appreciate you guys. And yeah, just thank you for the work that you're doing. I thought that was a beautiful way to start the presentation, Charles, and a beautiful way to end it, because you guys are doing amazing work and you truly are everyday heroes.
So Jen, I have a secret I want to tell you.
Oh.
Do you know what my favorite song is?
No.
Happy birthday. Happy birthday to you, Jen. No, it's it. I'm serious, actually. I'm not going to sing the whole thing because I don't want to embarrass you and we don't have much time. But I also turned 41 this year, and I can tell you that it's interesting to have your first day during a pandemic or after. So yeah, happy birthday. Enjoy it. And with that, I do want to thank you for just an amazing presentation. Both in the chat and in the Q&A, we have people raving about your presentation, so thank you for that. Yeah, I think we have time for one quick question, just clarification, and then we'll move into the announcement. Somebody by the name of Laura actually was asking, you know, when you were talking about the character strength, the statistics, do this apply for people on the line, the caregivers and people working with people living with dementia?
So it didn't break it down that much on the statistics. It would be interesting, and I mean, we can talk about it, Charles, but wouldn't that be interesting to see even what strengths do we have as activity directors, and do we have a lot of the same strengths? So I'm just saying, putting it out there, but it unfortunately the study didn't specify. It was not at that older adult community. This is for people that have filled out the survey.
Okay. And I think we just got another one. Actually, we're getting a lot of questions, but one, how can activity professional introduce this approach in a community when the mindset isn't there? And I mean, I'm sure that's a question you get often, but could you share one or two pieces of advice for somebody who wants to lead the change, but probably doesn't have the power to change everything overnight?
Yep. So you can't change everything, but there is one thing you can change, and that's you, right? I've walked into toxic teams before, over and over and over again. And the biggest thing is you start just almost like these sneaky little things, right? You're not going to be like, this is positive psychology and this is the new, but you start interjecting those joy walls, or you start talking about what's something, you ask your staff, what's the best thing that happened to you today? And then you kind of, you can throw in the studies. You can say, you know, research says that we actually talk about the 3 blessings that we've had today, they call them blessings, it can actually increase our happiness. Do you want to be happier? Like, do you, you know, it's almost like people have to say, I don't want to be happier, which can happen too in teams, but residents can sometimes be your best allies. I'm telling you, especially the ones, we introduced it in a resident council meeting. We introduced it in the book club. So I had residents reading some of these flourish books. Laughter, oh gosh, King, what is his name? Oh, I'll have to put it up there. It's, not Laughter is the Best Medicine, but there's some really great books, and that was where I started having the residents starting this movement even, and they started talking about happiness, and I had them choose, you know, as I said, choose some kind of a book about happiness. So those are kind of some things you can do it in that way.
Thanks so much for sharing. And yeah, thank you so much. So as a reminder, here is Dr. Taylor's email. We will be sending the recording and the presentation. And with that, I want to share just a couple more thoughts before we end the webinar today, which is that as Dr. Taylor has repeated several times, we will get through this one way or the other. But I think it's really important, and I know that a lot of people in the chat talked about this. Now is an amazing opportunity to change and quote unquote disrupt and improve our work. This is an opportunity of a lifetime, and as tough and difficult things are, there is a silver lining, there is an out, and we can work together to make it better, right? We know that social isolation is as bad as 15 cigarettes a day. We know, and this is a study that came out 3 weeks ago, they made a study that social isolation can increase your chance of developing dementia by 20%. And this is all extremely challenging. But this pandemic has also placed a huge amount of focus on our work. And I can tell you that all the providers that we speak to right after COVID, right after infection control, the #1 topic of area of concern is social isolation. And the key to fixing it is resident engagement, nothing else. So this is our opportunity to shine and improve our work. And again, like 91% of us agree, get out of this stronger. With that, I wanted to share a couple of thoughts and announcements. A lot of you in these webinars and follow-ups have asked on how they can learn about Link Senior. And I just want to tell you that we started doing this back in late July with a lot of success, which is that we started doing these open demos. So a lot of you have taken part of it. We will add that in the webinar follow-ups, but please feel free to jump onto these webinars, demos, and just learn about Link Senior. One of our upcoming events that I really want to share and emphasize, because it's a big event coming up, is the Activity Strong fall gathering. As you might remember, we did a very large event in June, and we're doing more of these in partnership with NAP and NCAP. And in the one in the fall is actually coming up. It's going to be 3-4 CUs, and that is basically that. That's basically that. The other announcement that I want to share with you is one of the things that people enjoyed the most in the summit, well, pre-summit I should say, is our bingo game, and we are doing it again. So stay tuned on our Activity Strong Facebook page. We're doing the bingo again, and there will be newer prizes, and I promise you the process will be easier and quicker than before. The last announcement that I want to share with you is something that we're all really excited about, and this is in the line of us measuring ourselves to improve. The Activity Strong initiative is really excited to share a tool for all of you. It's a free tool. You can find it on our website, on the Activity Strong website. It will be part of our follow-up also. It's a way for you within minutes to measure how good your organization is about resident engagement. We will not disclose the data publicly, but we will share recommendation for us to improve. And just as a side note, Dr. Taylor, who delivered the presentation today, was one of the contributors to it. So thank you again, Dr. Taylor. Thank you everyone for joining. Actually, we had a comment, Marty Doring, I know you haven't received your prize from the bingo. It's in the mail. And again, apologies for the delay on that. We had such a big response to it, so it took us some time to get to that, but we'll improve. So again, thank you very much for joining. These are our upcoming webinars, and we're past the time. So again, thanks a lot. Take care now. And thank you again for all the work that you do serving your residents.
Bye, thank you.
Thanks, Jen. I'm going to stop the recording. Yeah. How did you feel about